Now let's just quickly talk about the book, which is The Art of Pharmacoeconomics. I have it here, right here, so it's just kind of like the size of it. It is the first of its kind book that really takes the macro level approach to the methods, the skills, and the personnel needed to perform and evaluate this type of research. Many of us, you might be sitting and thinking, oh, I don't know when I will be personally doing this type of research. For the most part, if you're thinking about healthcare decision in general, you will be reading literature that looks and talks about cost. Therefore, it's very important it's very important to build the skill sets to do that, to know that if you're adequately evaluating that. What's particularly unique here is when we're talking about the personnel needed. Very diverse stakeholders actually are involved within the whole process. And so understanding that and recognizing that, especially as if you want to do these types of analysis yourself, is very beneficial. It serves as a very easy to read guide to the key elements that go into the whole process of conducting and evaluating. And I want to stress the two parts. So even if you yourself are not conducting it, understanding the various elements that go into this process is very important, even to just try to understand when someone tells you something is cost effective, what does that really mean? And does it mean what it is intended to mean? And you're kind of breaking that down and seeing that. So that's just kind of the overview there. Now, why this book was written, kind of the goals behind it as I was writing it. Now, this discipline, especially for those that are involved in pharmacoeconomics, they know it is a very technical discipline. There are several great organizations that are working within this space, several professionals that are widely published within this space is good, but it is very complex. So the goal is to really simplify a complex discipline to break down the skills gap and competency barriers faced by many healthcare professionals. So more people want to be able to understand what are these various different elements in a much simpler, digestible, foundational way. So this book really serves as an essential beginner's foundational understanding of the various principles and elements so that you can articulate, work on, and evaluate these different types of analyses so that you can see if they would apply to the your own decision-making process. So the hope is that by improving your abilities, you'll be able to understand, interpret, and actually critically evaluate the literature so that we can be able to best utilize the results that many of these analyses are offering into day-to-day decision-making and actually allow for better quality and greater uptake of these analyses when appropriate. But ultimately, when you do read the book, you're going to see the world of healthcare decision-making a little differently because you're integrating multiple aspects that go beyond just clinical. So now just to move a little further along, so the book is broken up into 3 sections and 7 chapters. So these slides here just basically will show you how they're broken up because like I had mentioned, that doesn't just cover the methodology, it goes into the personnel and skills and that type of thing. So section 1 is really more about the decision-making and pharmacoeconomics in general. So that's where you get more of the backgrounds and the concepts of healthcare resource allocation, value, decision-making, and whatnot. So I go into much more detail about the types of analyses to lay the foundation to get a lot more technical through the actual process. Then section 2 goes into designing, conducting, and evaluating pharmacoeconomics. So that's where you're going to go right into designing and curating the experience, thinking about how do we design, conduct these analyses, who to work with and why, who are the different individuals involved, how do you even begin to design your meetings around that, what are certain outputs, and then we go into a very significant tool that was created, which is the pharmacoeconomic canvas, which is really a framework of all the different elements in a very easy to read, easy to digest canvas. And then the last part is putting it all together, which provides information just like the summary of the book, references, index, and then empty pages at the end for any notes that you might have. So it's really broken up in a way that basically takes you through the foundational elements of what you need to know, all the way to then let's get specific as to the actual work that it entails, the different model inputs, what you need to do, which is all beneficial whether you read it or whether you create it or just evaluate it. Now, who should read this book? Now, the responsibility to ensure proper use of resources is not limited to any specific healthcare professional. We started off this webinar talking about the significance of resource allocation and how really everybody has a responsibility to appropriately allocate the resources, whether you're a physician, a pharmacist, a healthcare professional, a payer, an institution as a whole, a country, whatever it is positions that you have or whatever decision making you have a responsibility towards that. So really, if you make any decisions in healthcare, which we even do on an individual level, you would benefit from this book. But how it is designed, and we say like how it is, state that it is designed for those across the spectrum. So the students, from students to residents to fellows, all the way to healthcare providers and decision makers in these very different settings. Now, okay, sorry about that. Now, also, when you think about who would benefit, ultimately, if you find yourself a lifelong learner and you're really looking to broaden your scope of your skills and build your skills to better inform decisions, tackle the challenges really facing healthcare, and create transformational improvement, you're interested in all these different elements of which this will provide you the structure for that. And then also, like we had mentioned early on, right at the beginning, if you want to utilize more objective measures to inform healthcare decisions, this allows you to create those frameworks and those tools to start thinking about it like that. And then, of course, as many of us are trying to build the skill sets of the current and future needs, this is definitely going to be one, because like I mentioned, at least over the last 10 years, it is substantially grown and has definitely grown over the past 20 or 30 years. Now, for the use of the content of this book, so there's the application as a learner, as in a formal setting. So as a student or in a classroom, I know some of you are professors at a university that are actually teaching these courses. So as someone that has taught this in the university, this is very good for introducing and being a foundational element for that. But it is also really good for those out in practice that are beginning, again, any sort of, wherever decision-making is made in terms of whether it's with patients or institutions, that actually also applies. So whether you're in a formal learning setting, whether it is a classroom, whether it's a residency program, fellowship program, or you are out in practice and making decisions, whether you're in industry, health systems, policy levels, all of these types of applies, because you can do kind of these three buckets with it. You can learn the discipline as pharmacoeconomics and really get background and well-versed. It'll also help you actually conduct and evaluate. So it'll give you the step-by-step process. But then it'll also supplement. So many of you that are well-versed in this field, maybe have been working in pharmacoeconomics for 20 years, this is a great supplement to what you currently have, because there's several different elements that don't exist out there in the literature currently that this adds to. So that's that. I'm just going to take some questions now with regards to the book. I know I went through it very quickly, but it was just to give you kind of an overview of what the book entails. The book is available on Amazon if you would like to purchase it. And there's also more information on our website, salusvitegroup.com. And then, if you have any additional questions, I hope you all find it very useful and beneficial, and I hope you add it to your toolkit for this specific area. So thank you all very much.